Hello, good afternoon. I'm going to show you how to perform a pancreatic study and biliary study with this radial array echondoscope from sonoscape. This is the ultrasonic station. It is 60 station. This is a very advanced station. So you have the buttonry here, and you have a tactile screen. The tactile screen I can move in different angles to have more visualization. And the first I want to do is to put the data on the patient on to be able to take a picture or even videos. So I'm going to, as you see here the screen, we can put the name and the surname of the patient. And when you're ready to go, press OK, and here we go. Endoscope, and this is a radial array endoscope, and it's from view endoscope. You're going to see like a gastroscopy with no problem, vulnerability. Start the exploration, and okay, so we are going to perform the exploration. Normally, this is the bending point is you had a very good bending capabilities. We are going to go inside the patient, and it's practically like going with a gastroscope. So it's very easy to go inside. You have see. Okay, and I want to show you. You can see the image of the screen, and you can do a regular gastroscope with this echondoscope, because it's from view and it's very convenient, very easy to do. The pyloric, we can go inside the pyloric, and we can go to the second part of the duodenum, just as you do like with gastroscopy. Okay, we are going down again the antrum, and even you can do a retroflex maneuver like a regular scope. See, it's an amazing scope. You can do a retroflex even to find more difficult lesions to go, and it's the same that if you are working like a gastroscope. Okay, so now we are going to, this is a case with idiopathic pancreatitis, and we want to find the bile tract and see that there is no stones in the gallbladder. The more important in the patient, you see here the liver in the right part of the image. I'm going to pass to the valve here and collapse the lumen, and you see here the gallbladder. It's very easy to see the gallbladder. I want to show you different things of this endoscopic system. You have here the frequency, the U scan. The U scan is you change the U scan for having more resolution. If you use higher values, you have more resolution. If you use lower values, you have more differentiation. Okay, and other thing we can do is to use the PHA, and of course in this system we have elastography. In this patient there is no necessity to use elastography, but you can do. You see the image. Again, this is a tactile screen and it's very convenient screen. Okay, you have the chroma for changing the color of the exploration. If you want to do the chroma, different colors, and you have the DIN. The DIN is for have a more granulated image with more differentiation between the tissues, or more soft image. So you see in this system you can set a lot of different possibilities, and of course the focus. Change the focus, use the focus to focus in the image you want to see. Okay. So we are going to look for the gallbladder, and I want to see the... Apagame la luz, porfa, si podéis ahora. There is no stone, and after that we got to find for the pancreatic parenchyma and see that the patient has no chronic pancreatitis. Again, we go very easy to the second part of the duodenum. This is the liver, nice view of the liver. We are going to find for the gallbladder. Here we have the gallbladder. ¿Me podéis dar una esquinita con agua, por favor? Me vendría súper bien. It seems that we have no stones in the gallbladder. We can change for the dip or even the zoom to have a good. You can move the zoom and you can focus really good in the image you want to see. In this case, it's the gallbladder. And again, you have a lot of control in the console of the image you are looking for. I put some water to have more ultrasonic window. And what do we do in this kind of patient? I'm going to put less frequency. Is to move the gallbladder and see that there is no stone in the gallbladder. We push the gallbladder and we can see there is nothing moving on. It seems to have no stones in. Okay, I see no stones. So I'm going to find the pancreas. A little deeper. This is the pancreatic parenchyma. And we are going to play a little. I'm going to put more frequency to have more resolution. You can see here, like I change more resolution, very soft image. We have the dim, lower dim, more differentiation between the tissues, higher dim, more superficial resolution, and you scan the same, more diffuse, more clear, and I have a very good, nice view. I have here the pancreas, and I have the birsum here in the image. You can see it's a nice view of the birsum. You see here in the screen. I see no dilatation of the birsum. I see no irregularity of the birsum. I'm tracing now the pancreatic body. You see here in the image the pancreatic body. And when we release a little, you see the splenic vessels. Again, you can use the Doppler, and you can use the pulsated Doppler. If you press this button, you move the pulsated Doppler here. You can change the angle with this button. You can change the angle to make a good alignation, and when you are ready to go, you feel comfortable, just start, press update, and you have the Doppler. Okay, B mode, and again, you see, using a radial scope is very easy to see the whole pancreas in a view. We go tracing the splenic vessel, go inside, and now we are in the pancreatic area. I'm going to take off a little zoom. You see the pancreatic head, the confluence. I'm moving a little there. The pancreatic body, the birsum. In the first plane, you are looking for the birsum. At the end of the pancreatic tail, and I see no important lesion in the pancreas. This is a nice view of the pancreas. You can see here. Okay. I want to show you, you can use the tactile screen again to use elastography if you want. Again, there is no lesion, but you can use elastography. If you have a kind of lesion, you can use. And even you can use contract. This is the contract the contrast module you can use, but we are not using contrast, but it's very easy to move, and you see that the system is has a very quick response. So again, the Wilson and the pancreatic body, I see no lesions, and we are in the end of the, I have found no problems in the patient. Okay, finish. Thank you. Well, listo.